Today, I'm going to talk about chest X-ray basics. That is how to interpret a normal chest X-ray. Before interpreting any X-ray, it is important that we should always look for certain pre-readings. That is, there are certain things which we need to verify before interpreting an X-ray. First of all, the name of the patient. The X-ray should belong to the patient to whom we are looking for the pathology. Secondly, the date of the X-ray. This is very important because whether the patient has brought the X-ray of the same date to which he has come for the treatment or the X-ray is of some prior date. And thirdly, try to obtain whatever previous films are there for the same patient for comparisons. And fourth important point is that always look for that which view it is. Whether it is a posterior-anterior view of an X-ray, whether it is an anterior-posterior view of an X-ray or a lateral view, the view are always marked on the film. Then comes the quality control. We need to ensure certain things under quality control before interpreting an X-ray. The first important thing is the penetration. Now, whether the X-ray when taken was normally penetrated or under or over penetrated. If it is a normal penetration film, the ribs are seen through the heart. Here in this X-ray, we can see the ribs. We can see the ribs through the heart. We can see those ribs I'm marking through the heart. And the spine is barely seen. We can only see this initial portion of the spine, but the spine is barely seen here. In this segment, the spine is barely seen through the heart. If it is an over-penetrated film, then the lungs here we can see that the lungs are looking darker than the normal. It may obscure the subtle pathology. The spine, we can see the spine here clearly seen well beyond the diaphragm, and the lung details here are all missing. They are not adequately seen. In an underpenetrated film, the diaphragms are obscured. Here in this region, we cannot see the diaphragm properly. The pulmonary markings are more prominent. We can see here the pulmonary markings which are more prominent than they actually are. Third important thing under quality control to look for is the inspiration. Now, since the chest X-rays are taken in deep inspiration, so we can count 5 to 7 anterior ribs. Here we can see the posterior portion of ribs which are marked by the red color. You need to count the anterior ribs. Here you can see 1, 2, 3, 4, 5 and 6. We can count the 6 ribs here. So 5 to 7 ribs are seen for a normal inspiration. And the heart shadow here is not hidden by the diaphragm. We can here clearly see the diaphragms and it is not hiding the heart shadow. The next thing to look for is the rotation, whether the patient is standing straight or the patient is rotated. Now, if the patient is standing straight, the medial ends of both the clavicles, so since the clavicle is on both the sides of the X-ray and in the center we have the spine, so medial end of the clavicle should be equidistant from both the clavicles. It should be this distance medial end to spinous process and this distance medial end to spinous process. It should be equal. So it should be equal. In case if the patient is rotated toward any of the sides, then the distance will not be equal. Now, if we look at the first film here, we can see that the this right clavicle is at less distance with compared to the left clavicle medial end from the spinous process. So this distance is less as compared to the other side. So distance is less on the right side, so the patient is rotated towards the left side. So basically the patient is rotated towards the side where the distance is larger. And if we look at the figure which is below here, the distance is less on the left side, so the patient is rotated towards the right side. Then we need to look for the findings. Now, whenever we look for the findings on an X-ray, we start with the soft tissues and the bony structures. So we need to scan the entire bones, that whether any fracture is there or not, whether the two lung fields which we can see on both the sides, whether they are in symmetry or not, are there any masses or calcifications or any lytic lesions. Next thing to look for is the mediastinum. So first thing what we look in mediastinum is the cardiomegaly. So cardiomegaly is whenever the heart size increases. So for this we need to look for the heart where it is in maximum width in diameter. Take that measurement, and in the thorax look for where it is in the maximum diameter in width. Take that measurement. Then divide the measurement of the heart with the measurement of the thorax, and you will get a ratio. So that ratio should be less than 0.5 or half or 50%. If it is greater than this value, if it is greater than half or 0.5, then this means that heart is occupying more than 50% of area in the thorax, and this indicates cardiomegaly. Next thing to look for is the medial and hilar contours for increase in densities and deformities. Now, next thing to look for is the diaphragm. The diaphragms are seen on either side. So you can see two hemidiaphragms seen on the either side, and they are not very much dome shaped because the x-rays are taken in inspiration. So check for the borders. The diaphragms are sharp in borders. And right side of the diaphragm, here we can see that right side of the diaphragm, this side of the diaphragm is at higher position than the left because of the viscera beneath. And last thing to look for is the cardiocostophrenic angle. Now you see here the diaphragm makes an angle with the rib. Okay, so this is an angle which the diaphragm is. So here you can see that diaphragm is making an angle with the rib. Here you can see that angle. So it is an acute angle. Okay, this angle is acute angle, means it is less than 90 degrees. If this angle becomes blunt or it is more than an acute angle, then this indicates pathology. Next thing is to look for is the lung fields to determine abnormalities and their locations. So in lung fields, here in this X-ray, I have shown various uh, structures where you can see the right heart border indicated by the first arrow, this one, then the right heart border, then you can see the anterior hemidiaphragms on either side, then you can see the left heart border, the upper left heart border, and the aortic knob. Along with it, we can see the various lobes of the lung as well, which are indicated on the slide. So, ideally, we should remember these positions if we want to interpret an X-ray correctly. Then for interpretation of cases, it is important that you should be follow a systematic pattern. So be systematic, follow the steps. So first of all, you need to identify the pre-readings, then the views, then what are the quality control parameters, and then go for the findings. So it is a 12-step program for interpretation of the chest X-ray. where you need to take the pre-needings, where you need to identify the name, date, and old films, then the view it is, then quality control parameters, and the findings to reach to a conclusion. So this was all about a normal chest X-ray. These are the references. Thank you.